Hi, everyone. I'm Savannah Silk, Operations and Client Experience Manager here at MOOV Physiotherapy. Welcome to our MOOV Workshop series, where we explore our in-house specialty programming and share in-depth insights to some of our most commonly asked physiotherapy topics. Our team is made up of 5 physiotherapists with specialties ranging from pelvic health, which you'll learn a little bit more about today, to acute or persistent pain, sports injuries and rehabilitation, strength and mobility, and much more. We have 1 physiotherapist assistant on staff to specifically assist with our strength and mobility-based programming in our boutique gym space downtown Ottawa. Today, you'll hear from Alicia Oliver as she demystifies pelvic health for you. Over to you, Alicia.
Hi, everyone. Thanks, Savannah, for that intro. So like she said, my name is Alicia Oliver, and I am a registered physiotherapy resident here at MOOV Physiotherapy, and I am also a pelvic health practitioner, which is why you guys are here today. Let's jump right into this. So I just wanted to start off with a couple of pelvic floor facts for you all. The first one being that 3.3 million Canadians suffer from incontinence, which is about 1 in 4 women who have incontinence, which is quite high. So it's a very common thing that people are dealing with. 10 to 20% of women report painful intercourse, which is also something that deals with the pelvic floor. 25 to 50% of women experience pelvic organ prolapse, which is again quite a high statistic. Pelvic floor dysfunction can be the cause of low back or hip pain, which again is a very common thing in our society. And lastly, only 1 in 12 people, which is about 8%, actually seek out treatment for their pelvic health. So there's quite an imbalance with how many people are affected by pelvic health conditions versus how many people actually seek out treatment and get help for that. The next one that I wanted to touch on is that men have pelvic floors too. So oftentimes when we're thinking about pelvic floor and pelvic health physio, we think about women, we think about pregnancy and postpartum, but when in fact men also have pelvic floors and deal with pelvic floor conditions. So same thing, 3.3 million Canadians suffer from incontinence. So although more common in women, 1 in 9 men will still have incontinence as well. Additionally, sexual dysfunction affects about 40% of men by age 40, which again, very high statistic. Up to 75% of men have urinary incontinence 1 year after prostate surgery. And lastly, pelvic floor dysfunction can be the cause of low back, hip, penile, and testicular pain in men as well. So starting off, just to show that pelvic health is very important and it's a very prevalent thing in our society. So that's kind of why we want to talk to you guys today and just spread the word. So what are we going to be talking about today? The first thing that I want to talk about is what the pelvic floor actually is. So we'll get a bit more in depth in that so you can get a good understanding and appreciation for the pelvic floor. After that, I'll move into talking about the different pelvic floor dysfunctions that people may have, what those look like, what they can feel like. After that, I'll move into pelvic health physiotherapy, which is what I do. We'll break down kind of what that looks like and how we can help. And then after that, we'll talk about next steps. So after learning all of this today, what would the next steps be to help out with your pelvic floor conditions? So starting off, we'll talk a little bit about pelvic floor anatomy. So I have my lovely pelvic floor model here. So this is your pelvis and pelvic floor. You have your hip bones on either side. You have your spine in the back, your sacrum and tailbone. And then all of this beautiful red here is the pelvic floor. So looking from the bottom here, this is a female pelvic floor. So we can see at the top, there's an opening, that's the urethra. That's where the urine or the pee comes out. Underneath that, you have the vaginal opening. And then at the bottom here, you have the rectal opening there. So as you can see, there's a lot of muscles that deal with the pelvic floor. It is a hammock-shaped network of muscles, fascia, nerves, and it runs from the pubic bone in the front right here, and then it runs all the way to the tailbone in the back right here, and it creates kind of a bowl or hammock-like shape, as you can see. Like I mentioned before, both men and women have pelvic floors. However, there are some anatomical differences. So like I was showing here, there are 3 openings within the pelvic pelvic floor for females. And for males, obviously, they have the rectal opening, and then they have the urethral opening at the on the penis, but they obviously don't have a vaginal opening. Next, I want to talk about the different pelvic floor functions. So there's 5 main functions of the pelvic floor, and we call them the 5 S's of the pelvic floor, that being to support, to stabilize, they have sphincteric control, a sexual function as well, and then lastly, the sump pump. I will go more in depth on the first 4 in the next few slides, but just to touch on sump pump. So the pelvic floor plays a huge role in allowing blood flow and lymph flow from the pelvis. So we have a bunch of collections of lymph nodes up kind of in the armpit area, and we also have a big collection in the pelvis as well. And the pelvic floor helps to ensure that fluid is moving and being filtered. When there is a loss of that function, it can cause some swelling or pelvic congestion in that area. So that's a big important thing that the pelvic floor does, but let's dive more into the other functions now. So the first one I want to talk about is support. If you have a look more at the left side of the screen at the picture there, the pelvic floor, like we were talking about, it's a hammock of muscles. And there are 3 pelvic organs that the pelvic floor helps to support. So we have the bladder at the front. In women, we have the uterus. And then we also have the rectum. And the pelvic floor, it helps to support those organs against gravity, and also with increases of abdominal pressure as well. When you lose that support, that is what tends to lead to pelvic organ prolapse, either from the bladder, uterus, or rectum. The other big thing that the pelvic floor does is to help with stability. So if you now look at the picture on the right, the pelvic floor is part of your deeper inner core, and it works alongside 3 other things. So in this picture here, it's showing at the top of our inner core, we have the diaphragm. At the front, we have the deep core muscle, the transverse abdominis at the front. And then along the back on the spine is our deep inner core muscle called the multifidus. Those 4 muscles work together to form your inner core or deep core. And the pelvic floor specifically helps to provide a lot of stability through the hips, pelvis, and low back when we're transferring movements and doing different activities through our legs and spine. The other one I want to touch on is sphincter control. So as you can see in this picture again, the pelvic floor muscles help to control the opening and closing of both the bladder and the rectum. So like we were talking about before on this model here, the urethra at the top, the pelvic floor helps to control the opening of closing of that, especially when we're increasing our pressure in our abdomen, doing like jumping, sneezing, coughing, those typical things we think about with leakage. The pelvic floor helps to control that close so that when there is that increase in pressure, we don't have leakage. And it also helps to control the opening of the rectum as well, again, to prevent that leakage when we have an increase in pressure. And then the last S that I want to talk about is sexual function. So in both men and women, the pelvic floor helps to promote blood flow, arousal, and orgasm. So in men specifically, the pelvic floor helps to achieve and maintain an erection. And then in females, the pelvic floor, it rhythmically contracts and relaxes to allow to achieve a full orgasm in women as well. Additionally, we need to be able to achieve relaxation of the pelvic floor for penetration during sexual activity. And if we aren't able to achieve that relaxation, then that is one of the reasons that people may experience pain while they're having sexual intercourse or afterwards. Now, this is one of my favorite slides because I think this diagram does a really good job at showing the connection between the pelvic floor muscles and the diaphragm. So this is a big thing that we like to focus on when we're teaching people about their diaphragm and pelvic floor. So as you can see in this diagram, as you breathe in, the diaphragm is one of the main breathing muscles. As you breathe in, the diaphragm, it comes down and it flattens and expands. And that's when the pelvic floor should be relaxing and kind of coming down with the diaphragm. If it was doing the opposite, then the pressure would increase in our abdomen. So naturally, we want them both to kind of come down together. And then when you breathe out, that's when the diaphragm lifts up, and that's when the pelvic floor should be contracting as well. So this is something that we really like to focus on in our assessments and treatment, is making sure that they're working and coordinating together, because a lot of times when they aren't able to coordinate with each other, that's when you can experience some of the dysfunctions, such as leakage. The next thing that I want to get into is pelvic floor dysfunction, and some of the different types of dysfunction, what they look like, what they feel like, that sort of thing. So when we're talking about pelvic floor dysfunction, that's when the pelvic floor is either too weak, has too much tension, or it's uncoordinated, like we were just talking about. And that can lead to a variety of different dysfunctions, such as urinary incontinence, also known as leakage. It can play a big part in constipation. It can deal with pelvic organ prolapse, like we had talked about, pain with intercourse, and as well as low back, hip, and groin pain as well. And we'll kind of deep dive into some of those. Again, this is one of my favorite slides as well, and I like to tell it with everyone. I think it's a pretty common misconception that leakage is just an inevitable part of childbirth or as we get older. I think especially with women, it's kind of just an assumed things that happen, and people don't really talk about it or think that there's anything to do that can help them with that. But the real fact is that leakage, although very common, like we were talking about, 1 in 4 women, it's a common thing that happens, but it's not normal, and it's something that we can definitely help with physio specifically. So that's just something that I like to tell people. It's not something you have to live with. It's a very common thing, but it's definitely not normal. So first, let's talk about urinary dysfunction. So what this involves is incontinence or leakage for any reason whatsoever. That would be urinary dysfunction. We should not be leaking. So that can include our people who leak when they cough, laugh, sneeze, run, jump. All of those increase in abdominal pressure. That's a very common reason why people are leaking. That would be something that we would address. Their urinary dysfunction can also be talking about when you have urinary urgency or incontinence associated with that. So that would be a strong, uncontrollable urge to urinate with or without the loss of urine. So if you don't have leakage, it would just be considered urgency. If you do have leakage, then it would be incontinence. Some common triggers that people find is when there's running water, or when they're going up the driveway home from work, and then all of a sudden they get a strong urge to go, and it doesn't necessarily make sense that they would need to go then. That's what we would call urinary urgency or incontinence. It's also considered urinary dysfunction if you are going to the bathroom more than 8 times a day. So that would be urinary frequency. That would be something that we would want to address as well. Typically, we're looking between kind of 5 to 8 times a day would be the normal that we're looking for. Another dysfunction would be having to go to the bathroom in the middle of the night multiple times a night, or wetting the bed even as well. Below the age of 55 to 60, you should be able to ideally go to sleep for the whole night without having to get up and go to the bathroom. So if we're seeing that you have to get up 1, 2, 3 times a night, that's something that we would definitely want to look at. Once you pass the age of 60, then 1 time a night is considered normal. The other thing that I want to talk about is bowel dysfunction. So constipation is a big one that we like to talk about and treat. Constipation on its own is not a fun thing to go through, but constipation can also exacerbate or contribute to other pelvic floor dysfunctions as well. So it's something that we really like to tackle and work on. Constipation would be considered anything going less than 3 times a week. The range for normal bowel movements is anywhere from 3 times a day to 3 times a week, depends on the person. We're really looking at like the quality of the stool when we're talking about bowel movements, but anything less than 3 times a week is something that we would want to address. Bowel dysfunction can also include if you're having to strain with bowel movements or really brace yourself to have a bowel movement. That would be something that we want to look at. Having pain with bowel movements is not normal, or also having fecal incontinence. So not being able to control your bowels and having an accident in that case as well. Another very common thing that people experience is pelvic organ prolapse, and that's something that we treat pretty often. So when we're talking about prolapse, again, if we're thinking about the pelvic floor as a hammock, typically when it becomes weak or it's not able to support those pelvic organs, that's when it causes prolapse. So that would be those organs kind of coming down into the vaginal wall because it's not being supported anymore. There's, in women, 3 types of prolapse, and that's when we're talking about the different organs. So cystocele would be the bladder prolapsing. There's uterine prolapse, and then also rectocele, which is the rectum prolapsing down. And this is something that, again, pelvic floor physiotherapy can really help out. And it's a very common thing that people experience. The next one that I want to talk about is different pain dysfunctions. So the first one here is having pain with intercourse or dyspareunia. Intercourse should never be painful. So if it is painful either before, during, or after, that's something that we would want to address. Again, it should not be painful. And this could be due to a variety of things, but oftentimes we find that when the pelvic floor has too much tension, that can cause a lot of pain because, like I was saying before, it needs to be able to relax in order to have penetration. Vestibulodynia is also another pain dysfunction that we talk about. So vestibulodynia, if we're looking at the model again here, so the vagina is right here. Vestibulodynia is talking about pain around the vestibule. So that would be pain around that vaginal opening. So people can often describe that it feels like a burning sensation kind of right at that opening. If they're having intercourse, they say like, initially it's very painful at that kind of opening, but past that it's not too bad. So that would be kind of the vestibulodynia. And then vulvodynia would be pain in the vulvar area. So that's around that vaginal opening on like the labia majora, labia minora, experiencing pain more kind of around the vagina. There's also testicular pain. And for some people that can either be pain right on the scrotum, or it can also kind of feel like groin pain as well. That's something that the pelvic floor could be contributing to. Also penile pain, so that could be at the base or on the shaft of the penis. And then another common one would be chronic or unexplained pain that is not able to respond to treatment. And that could be pain anywhere in the hips, the pelvis, or the low back. As you can see from our model, the pelvic floor has a lot of attachments into the hips, into the spine on the back here. So when we have pelvic floor dysfunction, it can oftentimes be a contributing factor to those other pains, or it could even be the sole reason for that pain. So we want to have a look when that pain is just not going away and you're not really able to touch it or make a meaningful change. Sometimes we would want to look at that pelvic floor. Another big component of pelvic floor physiotherapy, which I feel like most people associate with pelvic floor physiotherapy, is pregnancy and postpartum. So there's a lot of different things that we can look at there. The first one being safe exercise during pregnancy. So we like to make sure that people are staying active and healthy and feeling good during their pregnancy, and we can give good recommendations of things that you want to try and maybe avoid, or things that don't feel good, and being able to adjust your exercise plan to make it feel good in your body and that you're able to do it while you're pregnant in a safe way. Another thing that we can look at is pain during pregnancy, whether that's low back pain, pelvis pain, pubic symphysis pain. Oftentimes people feel right in the middle there. That's something that we can look at. Additionally, return to exercise postpartum. So giving you the tools to make sure that you're progressing your exercise once you have your baby in a safe way. And then another big one is also diastasis recti. So if we're talking about kind of those six-pack muscles, that's when they separate, can be either like postpartum, they separate and then they don't come back together. When we talk about diastasis recti, we are talking about the width of how far apart they separate, but we also want to be looking at the depth of how deep that separation is too. And that's something that we can work on to regain that core strength and function when we're dealing with that separation. Another thing that we look at is birth prep. So that's talking about pushing techniques or prepping to push. We look at perineal massages to prep your perineum for birth, to allow that to stretch, to get the baby's head out. We also look at different pushing positions to find one that's most effective and optimal for you. There's lots of things we can look at there as well. And then the last one would be cesarean birth. So recovery from cesarean birth, that's a major surgery. We can look at kind of scar care, ensuring those tissues are being able to move as they should postpartum, and also regaining that core strength and just overall function of the pelvic health. Some other conditions that we treat, and this is not an exhaustive list, but endometriosis is one, erectile dysfunction, vaginismus, which is when someone is unable to put anything in their vagina, whether that be a tampon, whether that be to have penetrative sex. It's just too painful. They're not able to put a finger or anything up there. Interstitial cystitis and bladder pain syndrome is something we look at. Any sort of pelvic girdle pain, whether that's the coccyx or tailbone, the SI joints in the back, or the symphysis pubis in the front, like I was talking about. Umbilical hernias is also something we can look at, and post-abdominal surgery rehab. So whether that's a cesarean birth, a hysterectomy, abdominoplasty, or a hernia repair, those are all things that we can have a look at. Okay, now let's jump into more of what pelvic health physiotherapy looks like when you come into the clinic. What is there to expect? So the assessment, pelvic floor physiotherapy is the assessment and treatment of various conditions involving the pelvic floor muscles. Pelvic health physiotherapists like myself, we have advanced and specialized training to perform external and internal assessments of the pelvic floor. So we have to take additional courses after graduating to allow us to do those assessments. And pelvic health physiotherapists in Canada are required to be rostered within their college to perform internal exams. So not any physiotherapist can perform an internal exam. You do need to be rostered with those advanced courses that you take in order to do this kind of work. So the way that pelvic health physiotherapy looks at what we'll talk about in the next slides is we'll start off with your story, and then we go into our assessment, and then we follow up with treatment. So let's dive more into that now. So you can expect to have your initial assessment be approximately 1 hour. That's usually what we book out for that. And the first part of the assessment is really just to get your story, get a better understanding of what's going on and all of the different factors within that. So we may look at the history of your current condition and symptoms, what you're experiencing. We like to look at bladder and bowel function and different habits. We talk about sexual activity. If it's related to you, we would talk about gynecological history or prostate and penile health and history. We also really like to talk about sleep and stress because that can be a huge contributing factor to it. We look at your general health and fitness. And then most importantly, we look at your goals and what you're hoping to get out of physiotherapy with us. Once we do that, then we jump more into the assessment. So starting off with more of an external assessment, we like to look at kind of overall posture. We look at your breathing mechanics, as we were talking about before with that diaphragm. What does that look like? Because it can play a really big part in your pelvic health. We look at your lumbar spine movement, your hips, your SI joint, so all around the pelvis and the things that contribute to that as well. We have a look at your abdomen, what that feels like, if there's any scar tissue. If we're looking at diastasis, We look at functional movement. So what does it look like when you stand up from a chair, when you squat, when you do lunges? We're looking at all of these movements that you have to do in day-to-day life, because ideally that's what we want to get back to, is being able to do our normal day-to-day stuff. We also have a look at your gait or your walking to see what that looks like, as well as sometimes we look at impact as well. So what does it look like when you jump or run? If you're having leakage with running, we would really want to have a look at that to see what that looks like. And then we also do an external pelvic floor exam as well. So that's having a look at the outside of the pelvic floor. So we're looking at the perineum and the tissue health, what the skin looks like, all of that sort of thing on the outside. Next, we do an internal exam if that's something that the client is comfortable doing at that session. So I will note that the gold standard for assessing the pelvic floor is to do an internal examination. That can be vaginal and or rectal, depending on what the symptoms are presenting like. And what we like to do with an internal exam is we're looking at the tone of the pelvic floor, the strength of the pelvic floor, the endurance of the pelvic floor, the coordination, and if there's any tender points. So the way that we look at it is, if I were to assess the shoulder, I would really want to get my hands on, feel those different muscles, feel the quality, see if there's any tone or tenderness. That's the same thing with the pelvic floor. However, as you can see from our model, the only way that we're able to get to those muscles on the inside for the pelvic floor is internally through the vagina or the rectum. So that's the reason why we like to do that. I will note that it's important that you don't need to choose to participate in an internal exam on your first visit or throughout your physiotherapy treatment at all. So some people, they don't want to do the internal exam on the first visit, but may feel comfortable within the second, third, or fourth visit. Some people aren't comfortable doing an internal exam at all, and that's totally fine. An effective treatment plan can still be provided using our whole body approach centered around your goals. Our assessment and treatment is totally based on your comfort and consent. So we would never do an internal exam or anything you're uncomfortable with. We're always going at your pace, and that's the most important thing. After we do our assessment, we move into treatment. So first I want to highlight that the research shows that pelvic health physiotherapy is a very highly effective and successful treatment option. And it should be a first-line strategy for people before surgery or any other medical intervention for many pelvic floor conditions, including incontinence or leakage, pain, and prolapse. So it has been shown in research that pelvic floor physio is a very effective tool that we have. So a lot of people have heard the term Kegels before. Can I just do a lot of Kegels to make my pelvic floor nice and strong, and then I don't have to worry about all of these things? However, the short answer is no. So like we were talking about before, pelvic health dysfunction can be for a variety of reasons. If it's because the pelvic floor is weak, then Kegels or pelvic floor strengthening might be a good option for you. However, it's important that you get an assessment with a physiotherapist, because you may not even be doing the exercise properly, and it's hard to know until you get that assessment from a physio. Additionally, if you're dealing with the other end of things where your pelvic floor is actually too tight, then doing Kegels or trying to strengthen it even more when it's already tight, it may actually exacerbate your symptoms or make things worse. So it's really important that you get an assessment to determine what the best treatment approach for you is. So treatment, it can look like a variety of different things. It's really dependent on what you're presenting like, what your symptoms are, what we find on assessment, and then also what your goals are. So treatment can include a variety of different things. It can be bladder and bowel habit training. It can be doing stretches. It can be working on your breathing and coordination with the pelvic floor. It can be strengthening the pelvic floor or having to relax the pelvic floor more. It can deal with doing different working on sensation or nervous system calming. A lot of times we can be kind of ramped up through our nervous system, and that can cause a lot of pelvic health dysfunction. So it really is a variety of different things. Ideally, just working towards your goals and being able to function and do the activities that you want to do. So that wraps up the information side of things. So you've learned all of this great information about the pelvic floor. What are the next steps? What do we do now? So what I'm going to be doing is everyone that has attended today will get a free 10-minute discovery call from me. So I'll be calling you to talk about if you have any questions about what you learned today. If you think that that you would be a good candidate for physiotherapy and that's something that you want to look into, we could book an appointment, and we'll also go over the call on what you've been dealing with your pelvic health, and what information handout would be best to give to you, and we'll give you a free information handout as well. And it's important to know that you should share this information with your friends, because oftentimes, like we saw in those facts, a lot of people are dealing with pelvic health dysfunction and don't really know about it. So if you share with your friends, this webinar is also recorded and they can get the same benefits that you got. So thanks everyone for coming today. I hope you learned something, and you know more about your pelvic floor now.
Thank you so much, Alicia. If you'd like to learn anything about any more of our specific offerings, please feel free to reach out to us directly through any of our contact information noted in this slide or any of our social media channels. We welcome your feedback and any questions that you may have, of course. And if there's a specific topic you'd like to learn more about, you can contact me directly at info@moovphysiotherapy.ca, and we'd be happy to customize a webinar just for you or your team. We look forward to connecting with you again soon, and we hope that you have a great day.